So I just received the baby from the doctor, so I'm gonna go ahead and suction out their mouth and then their nose. And then I'm gonna dry them off, and that will stimulate crying. Once the baby is fully dry, I'm gonna place them on the bed underneath a warmer. And I'm gonna turn their head to the side to stimulate drainage. And I'm gonna go ahead and do my 1 minute APGAR scoring. So you're gonna do one at 1 minute and then another one at 5 minutes. So I'm gonna go ahead and assess their apical heart rate for 1 full minute. And then I'm gonna check their respiratory effort, and I'm gonna look at the color. It's normal at the 1 minute scoring for them to be a little blue in their fingers, toes, and around their lips. And I'm gonna check their reflex irritability. So I'm gonna put their arms up and clap and see if they jerk their arms back. And then I'm gonna slap his foot and see if he jerks back. I'm gonna check muscle tone in their legs and arms. And then I'm gonna raise them up and make sure that their head falls back when raised. And then I'm gonna check their umbilical cord, and I'm checking for bleeding or in the 3 vessels, the 2 arteries and the vein. And then I'm going to do my vital signs. So I'm gonna do the blood pressure using the right size cuff, the respiratory rate, axillary temperature, and the brachial and femoral pulses. And then I'm checking their reflexes, so I'm making sure that their fingers are grasping, their toes curl up around their, when you touch their feet. And then I'm gonna put my finger in their mouth and make sure they're sucking. And then I'm gonna move on to my head to toe assessment. So I'm gonna assess for any lanugo, any molding on the head, and then I'm gonna set them up and check the fontanelles and make sure that they're flat. And then I'm going to assess for any abnormalities in their head, face, extremities, fingers and toes, and their skin. And then I'm gonna put their wristband on the baby and the mother and get their footprints before separating them. And then once I've done that, I can weigh the baby. So I'm gonna take them out and zero my scale and then weigh them, and I'm gonna keep my arm over them the whole time they're being weighed to make sure they're safe. And after that, I'm gonna measure my baby. So I'm gonna measure their length in inches, and we'll make sure that their legs are fully extended when measuring. So from the top of the head to the heel, and that's 19 inches. And then I'm going to measure the circumference of their head in centimeters. And I got 38 centimeters. And then I'm gonna go down and measure their chest. And you just want to measure right at the nipple line. And I got 46 centimeters. And then I'm going to put a diaper on the baby. And then I'm gonna give them their vitamin K shot. So I would get a alcohol swab, and I'm gonna swab their leg, and then I'm gonna give them their shot, and then this would just go in the sharps container, and that would go in the trash. And then I'm gonna put a hat on the baby. And I'm gonna get a moist cotton ball, and I'm gonna cleanse their eyelids and put the antibiotic ointment in their lower conjunctival sac. And then I'm going to swaddle them. And then I'm just gonna make sure that the baby is warm and safe, that their bed is locked, and they're not in any distress or crying. And I'm gonna discard my gloves, perform hand hygiene, report and report.